Hi everybody, I'm Dr. Sue and
George Kardashian.
we're here at Artlipo, Lipedema and Liposuction Surgery. And today I just want to talk with Dr. Kardashian a little bit. He's been working with us for about 4 months now and has developed quite a bit of experience and some great results. And there's still a lot of people out there, following us, or, thank you for following us on Facebook and Instagram and everything. But they're asking, questions about Dr. Kardashian. Tell me more about him. I'd like to, do surgery with him, but I want to know more. So for those of you who don't know, I'll just tell you a little bit. He's an awesome orthopedic surgeon. He's one of the most respected orthopedic surgeons in Tampa Bay, here for 14 years, one of the partners of his practice, and really just, at a point where he is wanting to get into something different and more challenging because, he's been doing all this orthopedic surgery for a while. So welcome here.
Thank you. I'm happy to be here. And I feel like this is more of a natural progression for me because doing orthopedic surgery for over 14 years allowed me to work with some complex surgeries and work on some difficult tissues. And I regularly work on bone and muscle, tendons, repair nerves and blood vessels. And so,
are you safe?
I'm very safe.
Have you had any lawsuits?
No.
So he's squeaky clean and he's extremely experienced.
And you have to intimately know anatomy well in order to get to the bone from the top of the skin through the subcutaneous fat between muscles and nerves and tendons. And so this allowed me to really know all the contours and important structures hiding under the skin.
So as you may or may not have figured out, we concentrate on arms and legs. I'm not a do-all plastic surgeon who's trying to do breasts and face and tummies and everything else. I'm not even a liposuction doctor that does everything on the body. For the last 10 years, our practice has been focused on doing high definition arms, high definition legs, and then it really evolved right into lipedema. So what George is coming into is a practice that is going right into the areas that you have been supremely confident in working on.
Correct. I've worked in those areas for over 14 years, and I'm very confident in working with them.
Yeah.
Now, the type of work is different. It is more artistic. It's not restoring function and repairing things, but it's more artistic. But my being a hand surgeon, also doing microvascular surgery, allows me to be very precise,
meticulous,
careful, and so this is combined with the artistic skills, and this allows us to achieve results that we have.
So let me break in here, because you guys out there are asking, well, why would I go to an orthopedic surgeon compared to a plastic surgeon? Well, did you know that I'm not a plastic surgeon? I'm a cosmetic surgeon, and that's the only thing I can call myself at this point, because for the last 18 years, I've only been doing cosmetic surgery, specifically liposuction surgery. And I started off as an internal medicine doctor for 8 years, from 97 to 2005, before getting into the cosmetic area. So I don't call myself an internal medicine doctor now. I call myself a cosmetic surgeon because that's the only thing I do is liposuction surgery. And what you can trust with my track record of 18 years is that I'm a squeaky clean doctor. I don't have any catastrophes or anything under my belt. And I have come to develop the most advanced types of liposuction that there's no plastic surgeons in the United States that do high definition 360 arms, high definition 360 legs. There are some doctors now that are getting to lipedema, and a small number that have been doing it for a while, that do 360 work, but not the beautiful cosmetic high definition work that I've pioneered in the last 12 years. So I've had plastic surgeons that work for me, and some of them have been very difficult, but the truth of it is that plastic surgeons in general don't do the highly advanced, skilled liposuction that I've specialized and focused on 100% in my practice. And when I was looking for a doctor, I considered plastic surgeons, but when Dr. Kardashian came about, I know that there are some fantastic liposuction doctors that are not plastic surgeons, like myself, in the United States and around the world. And he's been so trainable. 2 years now, on and off, very patiently learning, and finally it became time that we brought him on. And I would say that I'm so happy because, you know, toot your horn a little bit, you've learned so much faster than other plastic surgeons I've worked with and have trained. And I've trained a few. I have probably 6 plastic surgeons in the last year and a half that have come to train with me. So I know what it means to train with doctors that have a ton of experience doing liposuction and other surgeries, and they don't know how to do what I do.
Well, thank you. And your results is what attracted me in the first place. And just practicing orthopedics and then switching to more cosmetic surgery allows me to evolve and become a better surgeon that achieves better results. Thank you.
Thank you. Thank you, everyone.